Jomar, and I just wanted to talk to you today about a drug called OPVEE, OPVEE. OPVEE. OPVEE is a nasal spray. It is an opioid antagonist indicated for the emergency treatment of known or suspected overdose in pediatric patients 12 years of age and adult patients. OPVEE, OPVEE. I'm going to talk to you a little bit about some statistics starting in 1971. 1971, naloxone was approved IV and IM. The US FDA administered approves naloxone for intravenous and IM to treat opioid overdoses. So in 1999, the opioid epidemic started. From 1999 to 2010, overdoses tripled. From wave 2 started in 2010, where they went from whatever they were using then to heroin was the big drug then. And so from 2010 to 2013, it was most generally just heroin. Wave 3 started somewhere around 2013, where the synthetic opioids like fentanyl were started to be used in the opioid overdoses. 2014, DEA sees an increase in fentanyl seizures, and they realize something needs to be done. In 2015, deaths continue to rise. 2015, Narcan is approved. The nasal Narcan was approved. Nasal spray was approved by the FDA. Just in 2015, it was approved for the nasal. You don't really realize how not so long ago that was. I mean, it's 2024, so nasal Narcan has only been approved 9 years. 2017, the public health emergency was declared due to all the opioid overdoses and deaths. In 2020, COVID hit. So everybody knows what happened in COVID. Everybody had to stay at home. We couldn't be with our family. We couldn't spend holidays with us. People got depressed. People started using more drugs, and overdose deaths increased. In 2021, and I can give you the studies where they gather all these numbers from. In 2021 alone, just in 2021, 106,000 people died of opioid overdoses. 106,000, that's insane. If you think about how many people we lost to COVID in 2020 and 2021, and then we lost opioid overdoses, 106,000, that number's insane, it's crazy insane. So I want to talk to you a little bit about OPVEE. I just wanted to share those numbers with you. So I wanted to share a little bit about OPVEE. OPVEE, again, it is a nasal spray. It can be used in kids 12 years and older, all the way up to adults, whatever age you are, as long as you're 12 years and you have a suspected or known overdose, OPVEE can be used. OPVEE's, it's 2.7 milligrams, the dosage is per spray. So every time you give a spray, you're delivering 2.7 milligrams. The half-life for OPVEE is 11.5 hours. 11.5 hours. I don't believe Narcan is that long, but OPVEE can stay in their system and help reverse their respiratory depression for 11.5 hours. It's amazing, especially if they refuse to go to the hospital, which who knows what they may do. OPVEE is a 0.1 ml spray. And the difference between the OPVEE and the Narcan, OPVEE, you can re-give a dose every 2 to 5 minutes until the patient wakes up. It is only designated for intranasal. Do not use it oral, only intranasal. Do not attempt to reuse OPVEE. After you have used your spray, get another one. It is a quick acting spray. You know how Narcan is, when you spray it, they're gonna come to, so just be careful because you don't know how they're gonna act, but you don't know how long they're gonna stay alert. With the OPVEE, I don't remember in the study the study I had to do. We all had, the ones that went to the training, we had to do it. I don't remember if they said there was a limit. I will have to follow up on that. Whereas I know Narcan, you give so many doses, and that's really all you're supposed to do. But with the OPVEE, that wasn't really told to us. So the thing about OPVEE is how we come about it was a drug company contacted one of our fire chiefs here in Warren County in Kentucky and said, hey, we have developed a new drug, or a new drug is out, and we want to donate so much of this. So each department, there's 9 volunteer fire departments in our city. Each department had to pick a person to go do the training, and I was our person. And you had to do the training and make sure you understood. And so once we did the training, then literally 3 days later, we received 250 doses, 250 boxes of these, 250 boxes. And in each box is 2 doses. So hopefully that would save one person. Maybe you would have to use more, but anyway. So we did that. We did the training. We received it. We've had to use it a couple of times, but I want to get into that in just a second. So again, one thing I do want to say is that the dosage for the pediatrics is the same as the adults. So there's no difference in the dosage. 1 syringe, 1 dosage. Again, you can redo it in 2.5 or 2 to 5 minutes. And then one thing I did want to say is that, this thing they looked at in the studies, the clinical trials of this, because every drug has to go through a clinical trial. And the thing that they looked at is they took so many people and they put them into respiratory depression, as they wanted to call it, not distress. And then they brought them out of it with the OPVEE. And they wanted to see what side effects they had, how long it took them to come out of it, which I really want to see all of the data for those, because I do research in my real job during the day, and I know how that research works, and I see the data. So I'm anxious. I really want to see the data, because I want to look at the different patients, the ages, how they cause the respiratory depression. I'm a nerd when it comes to that stuff, so I want to see that. And so they caused them to have the respiratory depression, then they pulled them out of it. So again, that's how they studied it. So I'm not sure the cost of it. Ours was donated, and the good thing about it, about the OPVEE, it's a 28-month shelf life. 28 months, so you're good to go. The thing is that the way it's got to be stored, it does need to be stored in room temperature. Don't let it freeze. It says 59 degrees Fahrenheit to 77 degrees Fahrenheit. Short-term excursions permitted between 4 degrees Celsius to 40 degrees Celsius, which is 39 degrees Fahrenheit to 104 degrees Fahrenheit. Do not freeze. Protect from light. Dosage administration. See the prescribing information. OPVEE, OPVEE. I'm very passionate about it. It's something that it'll help save a life, and with the opioid epidemic that we have right now, we need something else. We need something to help save the lives. Our kids, they're not scared of drugs. We don't know what we're walking into as first responders, so you should always have something, Narcan, OPVEE, whatever it is. And if anybody's interested in more information, I can send you the slides. They did give me some slides, but again, my computer died today. So, and then, you know, I did want to go over just some of the commonly used opioids that are used for treating pain. There's your common lists, but then your illegal illicit drugs is the one that's really causing our issues this day and time with our opioid overdoses. So again, one thing I like about the OPVEE is if you've ever been on scene and you're trying to do your best to save a life and you're rushing, some of the Narcans, you have to get it out, put it in a little plunger, put the top on there. I'm gonna drop it sometimes because I'm trying to do my job before EMS gets there, because again, I'm a volunteer firefighter and EMT, so I'm rushing trying to do the best I can. This, you don't have to hook it to the plunger, you don't have to screw nothing onto it, you just pull it out. Make sure they have a secure airway. That's the thing, you always have to make sure they have a secure airway. Tilt their head back, and I can send some quick start guides if anybody's interested. Tilt their head back, push it in one side of their nose, squirt it all the way in, put them in recovery state or position. You know, we do that on a daily basis anyway. 2 to 5 minutes, you can retry it until the person wakes up or until EMS gets on scene, or for instance, if you're a responding truck. So just wanted to share that. I wanted to share my passion for this. You know, our little community lost, you know, 2 17-year-olds a couple years ago to fentanyl overdoses, and we're exposed to fentanyl constantly here in our little town through wrecks, medical calls, or just going in houses. And so you need to be prepared. So everybody should always have Narcan, OPVEE, whatever you can to protect yourself and your partner. So again, OPVEE, 2.7 milligrams. It's an opioid antagonist. 2.7 is for 12 years and older. OPVEE.com, OPVEE.com. If you would like to see the slides I have and share some more information with you, contact me, and please, you know, critique me. I need some criticism. I'm a nervous person, so I need some criticism. So anyway, thank you for listening to me. Again, I'm Marie Jo Marr. I'm a firefighter and EMT in Smith Grove, Kentucky, and I just wanted to share my passion about OPVEE, OPVEE. Thank you.